Is your foot X-ray normal left? Normal foot X-ray. Normal foot X-ray. The X-ray of the foot shows the foot from 3 different angles. The standard projection is of the front of the foot, the back, and the opposite side. The lateral view also shows the bone structure of the foot. A patient should be able to walk normally during the X-ray. This image may show abnormalities, such as a fracture. It should be clear to the patient that the foot X-ray is normal. The X-ray of the foot is made in the frontal view because this image enables the doctor to tell which side of the foot is the left. However, the patient may not know which one is the right one. The lateral projection allows the physician to check for bone fractures and other abnormalities. In the following images, we can see a typical X-ray of the foot. In addition, we will see how the bones and joints are aligned. The lateral projection is the preferred type of X-ray because it allows a physician to see the hindfoot and the phalanges in more detail. The medial margins of each tarsal bone should be aligned with the respective metatarsal. We will also examine the calcaneum on an oblique X-ray to ensure that the navicular bone is properly aligned. The lateral projection X-ray is a good example of a normal foot. Normal foot X-ray. It allows the doctor to see the phalanges and interphalangeal joints. The lateral tarsals and calcaneus should be checked carefully. The calcaneum should also be examined. If there are any problems, the doctor can perform the necessary procedures to fix the problems. There is no need to worry if you are pregnant or breastfeeding. In many cases, a pregnancy is not a reason to postpone a foot X-ray. In addition to the lateral projection, the foot X-ray of the right foot shows the medial cuneiforms and the medial articulation of the Lisfranc joint. The lateral cuneiforms and sesamoid bones of the first toe are not affected. A child is less sensitive to radiation than an adult, so the X-ray of the foot should not be a concern for a child. It is important to have a foot X-ray of the left foot, as this is the main part of the foot. Normal foot X-ray. The X-ray of the right foot is the best way to see the alignment of the phalanges and interphalangeal joints. A normal lateral projection will show the lateral cuneiforms and the cuboid. The cuboid bone is not involved. The lateral projection reveals the medial cuneiforms and the articulation of the Lisfranc joint. The lateral cuneiforms and the interphalangeal joints are clearly visible on the oblique X-ray of the foot. The navicular bone is a normal feature of the foot. An oblique X-ray of a foot is a better view of the phalanges than a normal one. An X-ray of the foot should show the medial cuneiforms and the calcaneus. The lateral projection is the best choice for a normal foot. The lateral projection is a weight-bearing image of the foot. It is useful for identifying problems. The X-ray will also show whether the bones of the feet are aligned well. The calaneus is another normal part of the foot. A foot X-ray of the left foot does not require any special preparation. Normal foot X-ray, however, if you are pregnant, the X-ray technician will need to remove any metal objects or jewelry that will be on your feet. The X-ray may take as little as 15 minutes, and the exposure to radiation is less than a second. The procedure will not be painful for most people. The X-ray may be used to diagnose an illness or injury. The AP and lateral views of the foot are 2 types of X-rays. The lateral oblique view shows the medial column of the foot. The lateral oblique view of the foot shows the articulations between the first and the second metatarsals. The harasaxial view of the heel shows the calcaneus and the subtalar joint. A sesamoid view of the foot is needed to determine whether the sesamoid joint is the cause of the symptoms. Normal foot X-ray, normal foot Xray, normal foot Xray.